Good morning, everyone, and welcome. It is wonderful. It's wonderful to see you all here today for our third MetaECHO conference. We have so much to talk about and share since the last time we met in 2016. The ECHO movement has made tremendous progress in that short time period. We have so many new partners, new initiatives, even new countries. The movement is growing rapidly. In fact, 650 of you have registered for the conference this week. That's a record in our 3-year history of meeting. And for that, I want to say thank you to all of you. Thank you for taking time out of your lives to be with us this week. Many of you have come from far away, from Alaska, Hawaii, Montana, Missouri, from Canada, Kenya, South Africa, India, Kazakhstan, and many other distant locations. No matter how far you've traveled, we are grateful to have you here. Thanks to our partners, our clinicians, pharmacists, nurses, social workers, community health workers, the specialists at our ECHO hubs, and all of you who participate in our global learning community. Thank you for engaging in a model we share with abandon. Special thanks to the GE Foundation for sponsoring this conference and for sponsoring our replication efforts around the world. The Helmsley Charitable Trust that supports our work in diabetes, the Merck Foundation for our work in India, the Bristol Myers Squibb Foundation for our work in cancer, the Goradia Trust, individual philanthropists who are in the room today who have invested in implementing and replicating the ECHO model, a model where all teach and all learn. A special thanks to our community providers and participants for the knowledge you bring about the social, cultural, economic, and psychological aspects of the worlds in which our patients live. Your contributions enrich the dialogue of our learning community and help to produce care that is more holistic and customized to the needs of our patients. The people in this room know firsthand that health is so much more than healthcare. It's about people's everyday lives, the education they receive, where they live, what they do, how they do it. That entails a level of complexity that you don't typically capture in a large clinical trial. You learn it by being involved with people in their communities and through discussing real cases and exploring how to help people live healthier, happier lives. This should be the gold standard for effective care. So thank you all for making that real for us. ECHO today is not exclusive to healthcare. In fact, we are very excited about our progress in the education field with students, teachers, school principals, and superintendents actively engaged in the ECHO knowledge sharing networks. Thank you to everyone in the education community for your leadership and participation in this effort. And to everyone here today, thank you for your extreme generosity, for giving so freely, not only of your time and expertise, but your passion and your energy. You have very big hearts. And that is why we are here today, because together we are creating something that is much bigger than the sum of our parts. A culture of generosity founded on the principles of democratizing knowledge, mentoring others, and sharing freely with others. That is what our mission of touching 1 billion lives is all about. Just look at our world today. The health disparities on our planet are astonishing. Globally, there's a 36-year gap in life expectancy. A child born in Malawi can expect to live for 47 years. while a child born in Japan has a life expectancy of 83. Every single day, 21,000 children die before their 5th birthday. They die of pneumonia, malaria, diarrhea, and other diseases that can be prevented, treated, even cured, and often very inexpensively. Children from the poorest 20% of households are nearly twice as likely to die before their 5th birthday as children in the richest 20%. Even here in the United States, our health disparities are staggering. In the mid-1970s, breast cancer survival rates in African American women were the same as those for white women. Today, African American women die of breast cancer at 1.4 times the rate of white women. These inequities represent more than inadequate resources. They represent a lack of will to bring healthcare to the last mile of human need. You know, there's a lot of talk these days about moonshots, which are research initiatives to create new treatments, new drugs, new best practices, and innovative therapies. But not nearly as much attention is paid to implementation and dissemination of this wonderful new knowledge. Yet that's where our greatest improvements in health will come from. Unless we go that last mile of knowledge sharing and dissemination, we will not achieve our potential. As our ECHO colleague in India, Dr. C.S. Pramesh at Tata Memorial Cancer Center pointed out, more than a moonshot, we need an earth shot. The current situation with ever-growing disparities is not consistent with the values we hold dear as a nation and as a global community. Our old paradigm of knowledge monopolization doesn't help this situation. It hurts it. It contributes to poverty, sickness, war, and death. Sharing is the way forward. When we share knowledge with each other, we learn from each other. Everyone is enriched, and the amount of knowledge actually increases. I want to talk now a little about our progress. What are we doing now, and what remains to be done? When we met last year, I reported that we had 82 ECHO hubs to several thousand spoke clinics in 12 countries. We had just launched our first super hubs, and we were applying ECHO to 45 complex disease and issue areas. Today, there are 139 ECHO hubs in 23 countries, including Australia, Kazakhstan, Tanzania, Ecuador, Namibia, and many others, running ECHO programs that address more than 100 disease areas or issues. Now we have 10 super hubs, with a few more in the pipeline, and thousands of additional community spoke clinics. In India alone, we have more than a dozen ECHO hubs, and our work there is expanding quickly due to our partnership with the ECHO India Super Hub, the Merck Foundation, the Goradia Foundation, and many Indian government institutions have partnered with us to address diverse problems such as mental health, addiction, multi-drug-resistant tuberculosis, and hepatitis C. Just one example, after the Postgraduate Institute of Chandigarh in India began ECHO and empowered district hospitals to treat hepatitis C, 39,000 patients received treatment over 12 months with a cure rate of 93%. Before they started ECHO, they were treating less than 1,500 patients a year. Tuberculosis is a public health crisis in India, where 2.2 million new cases are diagnosed every year, and 220,000 people die of this treatable disease every year. The National Institute for Tuberculosis in New Delhi has used ECHO to train district TB officers in multi-drug-resistant tuberculosis treatment and case finding. And they now plan to expand this ECHO initiative to attack TB across India. In Namibia and Kazakhstan, ECHO has improved care for patients with HIV, and the government of Northern Ireland has set up 19 separate ECHO projects to improve access to specialized care for their population of 1.9 million people. The government representatives that are here today told me that they're going to start 11 new ECHO projects in the next 18 months for a total of 30 projects. These are just a few examples from the scores of amazing stories from around the world. Great things are happening in the US as well. We heard from Dr. Roth about the ECHO Act. The US Senate voted 97-0 in favor of the bill. The House of Representatives passed it unanimously, and President Obama signed it into law in December of 2016. The ECHO Act directs the US government to study the ECHO model and its potential to improve patient care for chronic diseases, to increase access to care for rural and underserved patients, to address workforce issues, and to improve public health. These findings will be reported to Congress within the next 18 months. Your passion and service to the underserved in your respective states provided the crucial evidence that convinced your representatives in Congress to support the ECHO Act. Thank you for making the case so convincingly that ECHO is worthy of national attention. Thank you. Meanwhile, we are expanding the work we began here in New Mexico to combat opioid addiction. We are taking that effort to a national level in collaboration with Health Resources and Services Administration. With support from the GE Foundation, we had started a program we called ECHO Access, which was focused on substance use disorders to train our own providers in New Mexico. But now, with HRSA, we are working with 110 federally qualified health centers all around the country to dramatically increase treatment capacity for substance use disorders in communities where the need for treatment is great, but the availability of effective care is very limited. In addition, through federal funding provided under the 21st Century Cures Act, another 20 states have signed up to use ECHO to combat opioid addiction. This Tuesday, 2 days ago, the Ohio VA ECHO health system demonstrated that they could reduce opioid prescriptions by 25% using the ECHO model in comparison to the national trend of opioid prescription reduction of only 10%. Most recently, thanks to a collaboration with the Bristol Myers Squibb Foundation, we have expanded our work in cancer. For many years, we've known that colorectal cancer screening saves lives. The federal government and the American Cancer Society, also here, have set a goal to screen at least 80% of the eligible population by 2018. Tens of thousands of lives could be saved that way. Yet across our country, only 38% of patients in the 11,000 federally qualified health centers currently receive age-appropriate screening. What a lost opportunity. At the other end of spectrum of cancer care, 6 million patients in the United States could benefit from better access to palliative care services. In India, fewer than 1% of patients have access to palliative care expertise. Our initiative in cancer is designed to address disparities across the entire continuum of cancer care, from prevention of cancer, to screening for early diagnosis, to survival after effective treatment, and palliative care. I invite every one of you to consider launching ECHO initiatives in this area. Both here and in the US and globally, the ECHO movement is truly on a path to success. This is a result of your work and your commitment to our mission. We are well on our way to touching 1 billion lives. How are we getting there? 5 phenomena are at work. First, there are more echo hubs launching every week, and the pace of replication is increasing. More than 300 universities, medical schools, and organizations all over the world have signed collaborative partnership agreements with intent to launch. Second, each hub is applying echo to more diseases and conditions and targeting new communities of learners. The echo movement now includes programs to train nurses, field death investigators, laboratory technicians, medical technicians, community health workers, and even prisoners to become community health workers and grief counselors. Third, our super hubs are doing an amazing job of growing our hub networks. MD Anderson has already trained many university and government echoes in cancer space. The American Academy of Pediatrics, a super hub, is training pediatric echo partners across the country and have launched 12 hubs. The Missouri Telehealth Network is training new echo hubs across the Midwest, and other super hubs are just getting rolling. The fourth phenomena behind our momentum is the spread of echo to areas outside healthcare, to education, to early childhood development, even to community policing and crisis intervention. New echoes in the fields of veterinary medicine, community-based research, and other innovative arenas are in development. We have a new and exciting partnership with the Sandia National Laboratories to amplify knowledge sharing in nuclear and weapons safety. We started, as Dr. Roth said, with a narrow focus of improving access to treatment of hepatitis C. But the fact is that improved knowledge sharing and guided practice are needed in many industries. Fifth and last, every new clinician or teacher or community health worker trained by ECHO has the potential to help thousands of people over a lifetime. In addition, they have a ripple effect because each of these people can mentor and share with other providers in their community who then go on to provide service. Imagine the possibilities, infinite possibilities over time to touch and improve infinite numbers of lives. We have focused on a number, 1 billion, and this is an incredibly ambitious goal and one we will certainly meet. However, more importantly, this goal, this number, is also a metaphor for our quest to change the world. What does that mean? It means creating a culture of generosity and sharing, and that takes a movement. No organization alone can touch 1 billion lives. It is only as a movement that we can collectively achieve worldwide change. Movements focus on collective change while organizations, in contrast, tend to focus on their own contribution to the mission and their sustainability. As a movement, we rejoice when our neighbors join the cause with us. As a movement, we share all the resources and tools at our disposal so that we can achieve our worldwide goal faster. It is as a movement that we truly are greater than the sum of our parts. We all belong to a movement to change the world by democratizing knowledge for social good. And we need all of you to be leaders in this movement. You are the glue that will keep our movement strong. I've talked a lot this morning about the power of sharing. As most of you know, sharing is not purely a selfless act. It is actually good for us as individuals. Research shows that our brains are wired to feel rewarded more for generosity and altruism than for selfishness. Many years ago, I came across the following quotation from the philosopher, physician, and Nobel Prize winner Albert Schweitzer, who said, "I don't know what your destiny will be, but one thing I do know. The only ones among you who will be really happy are those who have sought and found how to serve." Over time, as we have continued our work in ECHO, I came to realize that service to others was not just one way. It was the only way. What work could be more satisfying, more joyful, and more rewarding than service to others? That's where sharing with abandon leads us, to service and true joy of work. And that's the meaning of 1 billion lives. It's more than a number. It's about creating infinite possibilities for good. And in doing so, experiencing true joy. That is a gift that keeps on giving. More than 2,000 years ago, Confucius gave the following advice: choose a job you love, and you will never have to work a day in your life. We have taken Confucius's advice to heart. And as you heard from Ann Rhodes, one of our core values at ECHO Institute is joy of work. I encourage you to adopt the same core value in your ECHO projects around the world. On behalf of all my colleagues at the ECHO Institute, I want to express how fortunate we are to have you all as partners in this global work. And for that, I thank each and every one of you. I also want to thank our team at the ECHO Institute and Burness Communication, who have worked tirelessly to put this conference together. It is truly a joy to work with you all, and thank you again for coming to this conference. Thank you. It's now a pleasure for me to introduce our next speaker. Before I introduce him, I do want to say a thank you to Dr. Paul Roth for, of course, his very kind introduction to me, but also your amazing support to have nurtured ECHO throughout since its birth to where it is today. And of course, that was instrumental in our success.